This conference will now be recorded.
Good morning, everyone, and thank you for attending the Cure GN2 Townhall as well. So just a couple of housekeeping items. The Townhall is being recorded. So if you are not speaking, please mute your phone. The recording will be available on Bluetooth when it's available. And if you would like to ask a question and you don't want to speak, use the chat function on the right side of your screen. Our agenda is going to be reconsenting for Cure GN2, FMS compliance, CRO completion, Biosample Shipping, and components from the July Cure GN release. But before we get to this agenda, I'd like to introduce Dr. Dr. Andrea Oliviero, who is the University of Michigan, and she's here to tell us a little bit about her Cure GN Thank you.
Great, thanks, Melissa.
Yep.
Thanks for the introduction. Is everyone able to hear me? It did seem a little garbled.
Yes, I can hear you.
Great. So I'm Andrea Oliverio. I'm an adult nephrologist at the University of Michigan and a junior faculty member. I have a K23 award through NIDDK to study the reproductive decision-making of women with CKD and to help develop tools for patients and nephrologists to support this complicated decision-making. Through my K23, I've done some qualitative work so far at the University of Michigan here locally, but I'm really looking forward to disseminating a broader survey so that we can get a wide range of opinions on what women need in order to make informed decisions that they're comfortable with that support their goals. So what we've developed from our qualitative work is an online survey, and this is aimed at women who are 18 through 45 with kidney disease. And one of our recruitment streams will be through Cure GN as an ancillary study. We're intending this survey to be disseminated in the fall of 2021. So I'm just here today to give you an early heads up about it, and I will return again later in the year to talk about it again. But we think that this survey will take about 30 up to 45 minutes for women to complete online with a separate consent process that'll be IRB approved here at the University of Michigan. Participants will get a $20 incentive for their completion of the survey. And through Cure GN specifically, participants will have the opportunity to access the survey through the newsletter and on the dashboard, and will need to know their Cure GN study ID. As we get closer to recruiting, we will also distribute some IRB approved language for emails and flyers in case that is convenient and feasible for people as well. What we're looking to do with the information that we gain from this study is to really develop tools that help support shared decision making and women with when they face these decisions about contraception and pregnancy. And we're really looking forward to sharing that information back with the Cure GN community and with the kidney disease community at large. So this is just an early this is coming down the pipeline and hopefully will be disseminated later this fall. But if you have any questions now, would like or are interested in it in particular, please feel free to reach out to me through email. And my email is listed here below. Thanks so much.
Thank you, Dr. Oliveira. Is there anyone that has any questions? We look forward to having you back in October at the Town Hall to tell us more.
Great. I'll see you then. Thanks so much.
Okay.
Bye.
Thanks. Bye. Okay. So we are going to go on to our agenda. And the first item is reconsenting for Cure GN2. And we do have Julie Bulk from U of M on the line. Julie, did you want to go ahead and cover this?
Sure, I can. Can you hear me okay?
A little faint, but yes, I can hear you.
Okay, I'll talk louder. So we have had about 30% of Cure GN1 participants not yet reconsented to Cure GN2. So everybody is asked to just please continue doing, what you can to get our patients onto the Cure GN2. However, we would still like information collected. So we have people who are curious as to how that can happen. Basically, what it comes down to is what kind of an IRB application you have active at your site. So there are some sites that did close out the Cure GN1 application at their local IRB. If that's the case, then we just need you to touch base with your local IRB and see what they would prefer you to do. There's two options that we think would be the way to go based on what we have talked to our IRB about. One would be reactivating the original Cure GN1 submission. The other would be to open a secondary use application. Either one of these would allow you then, once it's approved, to collect data extracted from the electronic health record to fill in the Cure GN2 forms and give us information. And it's not just death and end stage treatment. It's that we'd be able to fill out other information as it comes up. So you would essentially be able to do chart extraction for any visits while still trying to get reconsented. So if you have an active local IRB approval for Cure GN1 and it didn't stop, you didn't transition into 2, you did, it was just a kind of a very open-ended application. There's nothing you need to do on your end for a regulatory action. You can just continue collecting data as you have been, and it's very seamless. It's the sites that have closed out Cure GN1. So I realize this has been a very confusing process. If anybody has questions, please reach out to me at the Cure GN regulatory email, and just let me know what I can help. So for options for reconsenting, we know patients are reluctant to reconsent. So just remember to offer them that, we'd like them to do the full study, but if they are still hesitant, the remote follow-up where they don't have to come in to see us with or without biosample collection. So we are still finalizing our remote biosample collection protocol. So we'll be able to give you guys information soon as far as how we think it would be best to get these samples processed and shipped out from the local labs. But they could do remote follow-up without samples collected as well. And then there's also the option for chart extraction. So we'd like everybody to reconsent into Cure GN2, even if they do it as chart extraction only and we never see them. If we can at least get a consent on file, that would be awesome. So again, let us know if you have questions. I think that's it.
Thank you, Julie. Does anyone have any questions for Julie regarding the reconsenting and consent process for Cure GN2? Okay. Again, as she said, if you have any questions, please don't hesitate to email us. So on to SMS compliance. We've had 980 active participants, and 19 of which have responded stop. And we've had 31 that have had invalid numbers, and we've had 142 alerts triggered as of July 15th. So we've also had 4,326 email messages or SMS messages go out. And out of those, we've only had 1,181 completed. That's only 27% of the SMS messages that are being responded to. So you want to remind your participants that this information is very important to us, that we do ask that they do respond to these emails, or sorry, text messages. Has anyone got any feedback from participants regarding their SMS messages, or any thoughts about why our completion rate is so low for these? Okay. Can everybody hear me okay?
Yeah, we can.
Okay. I just want to make sure. But it's something to think about. And again, like I said, just stress to your participants that, we really do want this information. That's why we asked for it. And it's very important to the study. And those that have responded stop, you can remind them also that if they decide to start up again, they can just send start to that email. PRO completion?
But Melissa?
Yes.
There's one of the coordinators in the chat said that, Lori, maybe you can expound on this a little bit, that patients have find the first text question about protein confusing.
Yeah, so our patients don't check their protein, and a lot of them in the past just saw that question and I don't think responded anymore. So we've been encouraging them to answer that first question and move on, and the next questions might be a little less confusing.
Okay. Yeah, I'll have to look at that. Okay. Thank you. That's really good feedback.
I don't know if in other practices your patients are checking their protein. None of ours do.
Okay.
And so they find it confusing.
Yeah. Oh, and we had somebody else that had the same feedback.
I wonder if it would be worth it to move that question to the end of the questions, and also maybe put a disclaimer, if you check your protein, please provide a value or something like that.
Yeah, definitely, because
seeing that first question and just not responding to the rest, which could be one reason
right.
for the slow rate.
Right, because it's like, okay, this question doesn't pertain to me, so probably the rest won't either. Yeah, I could see that. Okay, great. Thank you for that feedback. We'll look into that and see what we can do.
How many questions are they getting? I was under the impression that it was just one question that was just a quick response. Is it several?
I think it's 4 questions.
Yeah, and I think that, like, when you answer one, don't you? I think they get the next one. Vivian would be the one that would be able to tell us specifically, and unfortunately, she's not on the call today. So
right, we should probably find out, because I think is there a way of saying it's question 1 of 4, or maybe if they do part of it, then they get another question and they think, oh, I don't have time for this, and just don't complete.
Right, because they may not know like how many there are. Yeah, I will look into what the SMS messaging, like how it works, like how many questions. And
yeah, because if we can tell them how many it is of, is question 1 of 4 or 1 of 3 or whatever, just so that they know that there is an end. It's not going to be taking a half hour.
Yeah, definitely.
Okay.
I have a note here, and I can check in with Vivian about that.
Okay, thank you, Becky. Okay. Again, if anybody else has any other feedback, please, you can reach out to us at any time. So PRO completion. So we've had 608 participants with at least one in-person visit between June 30th of 2020 and May 31st of 2021. And these participants completed at least one PRO at their visit. It was only 523, so it's 86% completion rate, which is actually pretty good. Of course, we always want to see it much higher, but 86 is doing well. But for the 8 to 18-year-old that gets a PEDS QL, out of 179 that went out, only 88 have completed it, and that's a 49% completion rate. Now, yesterday on the town hall, we got some great feedback as well, that because the ones that are getting the PEDS QL are also getting the regular PRO email as well, coming through at the same time. And I was able to confirm that, yes, they look exactly the same, who they're from, what the subject matter is. The only difference is once you open it, the link is different. And so a lot of participants may be thinking they've gotten it twice in error and deleted the second one. So that could be what's causing part of this PQL completion rate to be so low. We are looking at possibly sending both of the links in one email to them, so they just get the one email with both links with instructions to complete them both. So I will keep you updated as to the changes with that. If anybody had any other thoughts about why the PQL may be having such a low completion rate, please feel free to speak up now, or if you want to just reach out later, that's fine too. Hi, Jeffrey, did you want to make a comment? Okay. So biosample shipping, I want to go ahead and give a quick demonstration because I know we've had a lot of questions lately about biosample shipping.
Melissa, while you're pulling that up, we just got an email from Precision Medicine about the cryovials being on back order. They have a different kind of cryovial that we can use, but I don't know if that needs to be approved by the DCC or if the NIDDK repository is okay with it, then you guys are okay with it.
Yeah. Do you want to forward that to me? Because I'm assuming that as long as the repository is okay with it, I don't see where we should have any issues with it. But
yeah,
just so we can be aware of it.
I replied and put the project management Cure GN on there.
Oh, great. Thank you. Yeah. And we've encountered this, I know, in other studies where the cryovials that we use are on back order just due to the pandemic, is what they've been telling us. So I'm not surprised. Okay. So when you go into your facilities task when it's time to ship your samples, it's automatically going to default to not started. So these are all the ones that have not been shipped yet. If you want to see the ones that you've already shipped, you would just clear out this and it'll show you every manifest that you've had since you've been in Cure GN. So let's go back and do the not started. So on here, we have the NIDDK genetics lab. That was for when we collected the ACD tubes, which we no longer do that. It's still on here though, again, because we have the manifest from Cure 2. We need to keep this on there so that we can still see those. Okay. The PCC is for the DNA, RNA. You would check with your PC lead coordinator to know if you're supposed to be sending to them or if they want you to hold on to those until further instructions come through. But it's according to your PCC what their requirements are for you. And that's what this manifests for. The scanning facility is for the DPR. And we hopefully will get that coming up soon, within the next couple of months, it'll be ready. And so we'll give you more instruction when that comes along. And then finally, we have the NIDDK shipping, which extends it to Precision. So we'll go ahead and open this one up. Okay, and the first thing you'll have is where the address to where it's being shipped at, so you can confirm, like, yep, that's the address we want to send it to. And then any unshipped samples will show in here. And unfortunately, I shipped everything yesterday during the Townhall. But we'll go ahead and we still have 2 samples here. So we'll go ahead and mark them as shipped. And now you can do this individually. Of course, when you have a list of, say, 100, it gets to be a lot to go through and click every single one. You can actually come up here to this button that says shipped, and it will ship all of the every shipment that's on the list. And if you want to say, like, you've selected all of them, but you have a sample that you don't want to ship, you could come here put in the barcode, it'll come up and you can just click it as unshipped. That way you don't have to look through the whole list either. Or you can also look by subject ID. So once you've selected everything you're going to ship, you want to come in and put in your carrier and your tracking number, and then the date of the shipment. So it does say here to please print 2 copies using the print icon at the top of the corner. So you go up here to print, and then you could print this page, or you can print all pages if you want to get the second page as well. These 2 copies, one is for your reference, and the other one is to go in the box with your shipment. Okay, this is not the one that you want to email to the repository. So if we hit continue, and it's going to tell you what's in the shipment. Okay, so we have 2 whole bloods in there, or whole urine. And it's just another way to confirm what you're shipping. Okay. And then what you'll do when you know that what's in the box is what's on the manifest, everything's good to go, you want to send a shipping. And what this is doing is it's locking down the manifest, saying, okay, this is what's being shipped. We're not changing this. If something happens later on and you have to have something changed on this manifest, let us know. We can unlock it for you. So once you send it to shipping, then you want to email the manifest to the destination facility. So go ahead and click that, okay? And it tells you that it's been emailed to the destination facility, which would be Precision in this instance. Another copy will also come to the DCC, so I'll be able to see it, as well as a copy to your site. In this email, in the attachment, is the manifest in CSV form, which is the form that is required by Precision. And that's just so that they can easily upload the information to their system. And here's the email that comes. And you'll open the CVS file and you'll see like it looks very similar to Excel, but they do want it in the CSV file format. Okay. What we'll do, and so now you see that the NIDDK one is not on here anymore, and it's because all the samples have been shipped. So I'm going to go down to one that's been completed, and you can sort by the receiving date or the ship date. So here's the one from yesterday. You can sort by due date, the status, what's been completed, not started, the event, which is who it's getting shipped to. It's going to go very slow to do this. So I just wanted to show you when you have more than just a couple of samples, what it looks like. Are there any questions about shipping? So here's the manifest that has a lot more. And like I said, once you have so many, it is easier just to click the shipped. And you can see that when I try to hit it now, it's locked. And that's just because we sent it to shipping. Okay, and then go here to the next page. And so this shows you like all the different types. So we how many, like 33 EDTA, 6 for heparin, 60, the different, how many of each type. Just another way for you to confirm what's in the box is what you're actually shipping. Okay. Any questions? Well, and of course, as you're doing the shipping, if you have any questions, please reach out. Happy to help. Okay. So the GN link updates for July. You'll always be able to find the release notes, and they're actually on Basecamp under Cure GN headquarters, Docs and Files, 2.0 CRF, and GN link release notes. So a couple of things that happened is the COVID form changes. So the questions about the COVID diagnosis, infection, antibody testing, and vaccination have now been incorporated into the regular enrollment and follow-up CRF. The prior ad hoc forms that were in Link are still visible to you, but you're not able to add any new ones. So the ad hoc form is no longer used. And only certain questions from the prior ad hoc form, specifically A1A and A1B, will be mapped to the existing forms in the Cure GN or COVID-10 can grow table section of the JLab 2 on the follow-up CRF. And we can go in and show you that. We'll find the follow-up one. So we go under lab 2. Then we have the COVID-19 here. Okay. And this one didn't have any in this before, so it doesn't have anything shown now. Okay. But this is where you would enter the COVID information on the lab. Okay. And then we have A7C on the contact information here. Now allows a decimal point for the census tract answer. So I know some people have gotten, when they go in to get a census tract, it comes back with this decimal point answer. So now you can enter those. If you do run into any additional problems, just let me know. We now have a no IST pre-enrollment meds confirmation question. It's questions K1A and K1B on the enrollment assessment CRF. Also, when the stop EPRO email and SMS when a patient reaches the end of the study. So they won't continue to get those emails or SMS text messages if they leave the study. And this is just more of an FYI for you that we added the facility ID to the dashboard API. The users are not going to see this. It's not visible to them. It's just for the DCC reference. But again, just kind of an FYI for you. The visit status by patient report has been updated. We removed the gap between Cure GN1 and the Cure GN2 visits. And we updated the visit name to include year and visit number. We also did that with the visits on the iTask. And just to show you, here is the visit status by patient report. One thing is, for some reason, some of the colors are not showing up. So visits missed are still showing up as blue as opposed to the orange. So they are working on that. We should be getting that back with the next release. But I will keep you informed of that. Okay. So now you see, instead of having the headers at the top, each visit for each individual participant, it lists which visit it is for them. If it's their enrollment visit, year 1, B1, and so on. And those that have the 2 in parentheses means it's a Cure GN2 visit. And of course, this is the test site for Cure GN2, so they're all Cure GN2 visits. A couple other things, these are GPR related. We added the pathology report QC step after the report upload before sending it to the pathologist. And those are actually completed by the DCC, in more particular, myself. And so what will happen is when you upload a pathology report, when you enroll a new participant, I will go in and just confirm that, we're able to de-identify and label everything correctly. It does just a second set of eyes, because we know how difficult it is sometimes to find everything. Some things are really hidden in those reports. So if I do find anything, I will send you an email just to let you know so that you can fix it and re-upload it. And then let me know. Oh, yep. Mm-hmm.
I just wanted to ask a question about the pathology piece in Cure GN Link. Is there going to be a time when that pathology tab comes back on our dashboard so we can see the pathology CRFs when they're put in and have that, whether or not they're eligible or not? Because for some reason that's gone away on our dashboards, but it's super helpful in terms of seeing what needs to be done and what's been done in terms of DPR CRS or pathology CRS.
Yeah, I will double check on that. I do know that once I've done the QC and I hit enter, then the email goes to the pathologist. Once they complete it, they will, when they hit OK, the site will receive an email that says whether or not the participant is eligible.
Yeah, I know.
So I know.
To be able to go back and see all of the information in one place, though.
Oh, yeah. No, I totally understand that. I do. And I will check on that. But just in the meantime, as long as I just want to make sure the sites do know that they will have something that tells them if their participant is eligible or not. So,
Okay.
But yeah, I will check on that. And then the other DPR related item was that we added active crescent question to the core scoring CRF. Again, more just informational for you. It doesn't affect you guys, the core scores, but it affects. Okay. Any questions so far?
I have questions about the study overdue task.
Okay.
In Cure GN link. So we have patients in there who aren't doing the study, possibly deceased. Is there any way to keep them from going into that section?
Okay, so you want to, yeah, so what you can do is on the census, if you have somebody, especially if they've deceased, you could just fill out the study end form, okay? You would just come in here and the date of withdrawal from the study, and then you could mark deceased, or if they withdrew by choice, or whatever the reason is. So you can just enter that in here.
Okay, so you think we have them coming into there because we don't have study end forms? Okay.
Right. Yeah.
Okay.
Because you will continue to see them unless you have the study end form. Mm-hmm.
Okay. Okay.
Yep,
And then it appears a lot of our patients have not been doing the email quality of life questionnaires.
Mm-hmm.
Is there any way to get those off the overdue study task list?
So yeah, you can do that. So what you can do is, let's go here.
Working very well.
We have the quality of life here. If they don't complete it, you can go to the very last question.
Okay.
And you can, if the form was not completed, this one was not completed prior to the due date. Or if there's another reason why, you just select that, hit questionnaire complete, and click continue.
Okay, great. Thank you.
Yeah. Mm-hmm. Now, just to let you know, if they have a visit window that's open and they leave the study for whatever reason.
You're fine. You're not bothering me. I'm about to go to the lab anyways.
Are you sure?
Mm-hmm.
Okay. Hang on one second.
I'm filling out the stuff.
Okay. So if you're in the middle of a study window, so say the study window was open from June 1st on, and then you have a participant who leaves the study on July 1st, you will still show that visit on your iTask list. To get that off, you would want to mark it as missed if they did not complete a visit within that last month they were in the study, okay? But still fill out the study end form as well so that no other future visits will show. Okay. So if you have questions or any issues that come up, especially with link, you can email the Cure GN project management at arborresearch.org. You can also CC the Cure GN help if it's link related, and then definitely copy your PCC lead coordinator so they're aware of what's going on. And please make sure to include examples like study ID, which visit it's for, which CRS. The more information you give us, the quicker we can find a resolution for you.
I was just looking on Cure GN link and I don't see that question you showed about them not doing it. Where is that found?
So IPASS, okay, so let's find, well, here's an adult quality of life. We'll go to that one. If you go down to the last section, so questionnaire completion section, is
Yeah,
where it asks that.
I don't have those.
Huh.
It just shows. I wonder if it's because it's old. Is that something you added?
Oh, this is for Cure 2. Yes. So if it's a Cure 1, you can just go ahead and mark it questionnaire complete and hit continue to get it off of your list.
Okay, so these are old, and so if they don't have all those questions. Okay, questionnaire complete.
Okay, that's fine. Thank you. Again, because I'm working on the test site for Cure GN link for Cure GN2, I don't see the older ones, and that's why my examples are showing those. So yeah. Okay, great. Thank you. So the next round of town halls is October 2021. So keep an eye out for those dates once they're scheduled. If you have any suggestions or ideas of what you want to see, please just email us at curegnprojectmanagement@arborresearch.org. We want to make sure that what we're giving you guys is relevant information to you and helpful. I also wanted to say, because I know when we show you the compliance reports and we want to know, like, why are we not getting the compliance that we want? We know that you guys are doing just a wonderful job reaching out to your participants and making sure to try to get every visit possible in. And we do appreciate it. And we know, we hear from your lead coordinators that you guys are doing so much work, such hard work, and it is so much appreciated. And that's one reason why we don't do like, oh, these are the really good sites. These are the sites that aren't doing as well. We're a team in Cure GN, and so we just want everybody's input on like, what can we do to help improve these things? So any thoughts that you have, suggestions, questions, please let us know. Your input is so important to the study. So now, any questions, comments, feedback that you guys have, it doesn't have to cover what we've covered today. It could be something else with Cure GN. Just please, this is your opportunity.
Could you tell me, please, where you find the hospital form if someone goes to the hospital in between visits?
Yeah, so let's go in. If you go to Add New Ad Hoc and select Cure GN protocol and hospitalization, and the 2 again represents Cure GN2. Okay, let me just hit Add. Now, you can put it in for the date that they were admitted or by the visit, however you want to enter the information in. I just put it in today's date. The date that you add here, the date for the ad hoc event, is the date that it's going to use to put it into the ITS. Okay, so it's going to be chronological. But when you go in and do the actual form, you want to make sure that you use the actual date of the hospitalization or ER visit. But yeah, it's here in the ad hoc.
Thank you.
Yep. Okay. Any other questions?
Is there a way to see what the patient dashboard looks like from the patient's perspective?
Yes. That is something, though, that I'm not able to help with. Becky or Julie, are either one of you able to provide that example?
So we're currently we're actually working on getting those updated right now. So I don't have a final product to show you, but there should be a way when we get those little kinks worked out.
Okay. So maybe we can provide some screenshots once everything's been updated.
Absolutely.
Okay.
Yep.
Thanks, Becky. Yeah, because it's always nice to know what everybody else sees, especially when you're trying to explain. So Okay. Are there any other questions? Okay. Again, if you have any questions, please don't hesitate to reach out to us. And again, you can reach us at the Cure GN Project Management at Arbor Research. We are happy to help in any way we can. Okay. Well, if there are no more questions, we can go ahead and let everyone go and enjoy your day. Thank you for coming to the Townhall.
Thank you. Thanks, Melissa. Bye-bye.